state to big city. You might even say it's a big state or a small state that wants to be a big state. Chicago is certainly a big city, though. Hundreds of thousands of people crowded Grant Park. Despite all the concerns about the Delta variant, Chicago's Mayor Lori Lightfoot defended the decision to hold the event, otherwise known as Lollapalooza, because everybody who went into the Lollapalooza festival had to either show a negative COVID test or their vaccination card. Dr. Allison Arwady is the health commissioner for Chicago. We appreciate you being with us, ma'am. Thank you. You just heard the Attorney General of Missouri talking. Is he putting lives at risk in Missouri by fighting these mask mandates?
So what I did like hearing him say was that the vaccines are effective and by far the most important thing that people can do to help protect themselves. I'll tell you, here in Chicago, we have just started to see some increase here in our numbers. And in that setting, following the CDC guidance, we've asked people to temporarily put masks back on just to help us get through this Delta surge. But I also agree with the person who was on before saying that we're watching hospitalizations and deaths. I'm not concerned about overwhelming the health system at this point. We have a free and widely available vaccine. And in those two settings, we don't want to close down. We want to be open, but we want to do everything we can to be, open and careful. And vaccination is the main key to that.
Nobody wants to go back to lockdowns, for sure. Right. It's interesting you talk about the CDC maps and the spreads, and they talk about mask mandates where there is high spread. Cook County, as you know, is in the red level. Why is this a recommendation and not a mandate?
Yeah, so actually Cook County is in the orange level, where there's
maybe
four
Chicago
levels.
That's red. Okay.
Yeah, well, Chicago and Cook County are both at that substantial level. And so we waited, and we really have tried to very much follow. We've been using actually the same metrics here in Chicago all along so that people have a sense of when we are making recommendations. It's based on that risk.
So a mask mandate, and I ask this simply almost selfishly, because I don't think anybody wants to get to a mask mandate, but that's still on the table.
So, right. We've said, while we're here at the substantial space, we thought it was appropriate. Only when we crossed that threshold did we make that recommendation. And I think if we do get into that red high, that's when we might consider it. We've seen folks here in Chicago step up already before in terms of protecting themselves and others. And what we've seen when you look internationally, these Delta surges, they can be very fast, but then they are coming back down. So I've been telling folks this isn't forever, but it's to help get us through while we keep trying to get people vaccinated, which remains by far the most important thing. And more than 90% of the folks coming into Lollapalooza there were vaccinated. If more than 90% of Americans were vaccinated, we'd be putting this largely behind us.
Okay. People say, though, and we heard this from the CDC, that scared everybody so much that vaccinated people can spread this. But something like Lollapalooza, you don't worry about becoming the super spreader like the event the CDC covered?
Yeah, so here's how we think about this. I felt strongly about having a vaccine or testing requirement, first and foremost, for that gathering. It is an outdoor gathering, which we know is one of the safest things that can help with gathering. And it is almost all young people. So if this had been in a state that was really surging, if this had been indoors, if this had been 70 and 80-year-olds gathering, I don't know that we would have been able to move ahead. I expect we'll see some cases just because of the sheer number of people.
It also brings in $1.7 billion to the city, which is something you don't want to shut down, considering what Chicago's been through. These statistics caught our eye, and I wanted to get your thoughts before we let you go. 105 homicides in July in the city of Chicago. That's from the Chicago Police Department. 69 COVID deaths, sourced from the New York Times COVID tracker. Is gang violence now a public health crisis in Chicago?
So we've actually been taking some of the lessons that we've learned from the COVID response and working on applying them actually to do a better job for preventing and responding to violence, using some of what has worked well with public health. So I think we're really trying to. Is that a yes? Is that a yes that it is a public health crisis? I think it's certainly, we've been using the term that this is a public health issue. And I want to be careful, when we label things crisis, I want to make sure that we're identifying specific funding. And that's certainly something that we're working on and the mayor's really committed to.
How many more people would have to die over we know COVID's a crisis. How many more people have to die over COVID from homicides to make gang violence a crisis?
So where we look at over COVID, I mean, these are both major public health problems in Chicago, don't get me wrong. But where we look at the number of homicides, over the last year and a half, we've had more opioid overdoses than that. And we've had 5 times more COVID deaths than that.
Okay.
And so
in
these are
totality.
all issues, and we're trying to work on all of them together. But let's get people vaccinated and have COVID be something that puts behind it. We don't have a vaccine for violence in the same way, but we definitely want to use some of these lessons. And we are really trying to take this seriously and work on it. But I don't see these as separate things. They both need attention.
All right, we'll tackle the violence in Chicago coming up in about 15 minutes. Doctor, we appreciate your time. I know it's been a busy weekend for you. Get some rest.
Thank you so much.
Thank you, ma'am.